Hello, my name is Dr. Israel, and I'm a Chief Medical Officer at Parker Jewish Institute. Today, we'll talk about diabetes. What is diabetes? Diabetes is a disease which occurs when your blood glucose, also called blood sugar, is too high. And the blood glucose is your main source of energy and comes from the food you eat. And as long as we understand how diabetes develops, I think we will understand more how to manage it. And today we'll talk about diabetes type 2. We have a lot of types of diabetes, but diabetes type 2 is most common. What drives the high level of blood sugar? In diabetes type 2, it's two components: low insulin level and so-called insulin resistance. We have the beta cells in our pancreas which produce insulin. And as long as we put the glucose in our body, so pancreas is producing enough amount of insulin to bring glucose to the cell. What happens in a patient with diabetes? The pancreas is not producing enough insulin, and on top of it, the tissues, peripheral tissues, they resistant to insulin. It means more blood sugar is circulating in the blood. And if sugar circulates in the blood for the long time, it causes end organ damage. In this case, we have to go step by step and find out how we can manage diabetes. And again, I would like to repeat, we will talk about diabetes type 2. Who is more likely to develop type 2 diabetes? You're more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or overweight. Physical inactivity, race, and certain health problems such as high blood pressure also affect your chance of developing type 2 diabetes. You're also more likely to develop type 2 diabetes if you have pre-diabetes or had gestational diabetes when you are pregnant. What health problems can people have with diabetes? Heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, food problems. What are the symptoms of diabetes? Increased thirst and urination, increased hunger, fatigue, blurred vision, numbness of or tightening of the feet or hands, sores that do not heal, unexplained weight loss. Symptoms of type 2 diabetes often develop slowly over the course of several years and can be so mild that you might not even notice them. Many people with type 2 diabetes have no symptoms. Some people do not find out they have the disease until they have diabetes-related health problems such as blurred vision or heart trouble. What causes diabetes type 2? Type 2 diabetes, the most common form of diabetes, is caused by several factors including lifestyle factors, overweight, obesity, physical inactivity, insulin resistance, genes, and family history. Is diabetes type 2 preventable? You can help prevent or delay type 2 diabetes by losing a modest amount of weight by following a reduced calorie eating plan and being physically active most days of the week. And another question you might ask: how can I lower my chances of developing type 2 diabetes? Lose weight and keep it off. You may be able to prevent or delay diabetes by losing 5 to 7% of your standing weight. For instance, if your weight is 200 pounds, your goal would be to lose about 10 to 14 pounds. Move more. Get at least 30 minutes of physical activity 5 days a week. Eat healthy food most of the time. Eat smaller portions to reduce the amount of calories you eat each day and help you lose weight. What should I do if my healthcare professional told me I have pre-diabetes? What is prediabetes? Prediabetes is when your blood glucose, also called blood sugar levels, are higher than normal, but not high enough to be called diabetes. And having prediabetes is serious because it raises your chance of developing type 2 diabetes, and many of the same factors that raise your chance of developing type 2 diabetes put you at risk for prediabetes. About 1 in 3 Americans has prediabetes, according to recent diabetes statistics from the Centers of Disease Control and Prevention. You will not know if you have prediabetes unless you test it. What should be tested for diabetes? Anyone who has symptoms of diabetes should be tested for the disease. Some people will not have symptoms but may have risk factors for diabetes and need to be tested. Testing allows healthcare professionals to find diabetes sooner and work with their patients to manage diabetes and prevent complications. What tests are used to diagnose diabetes and prediabetes? Fasting plasma glucose, hemoglobin A1C test. And hemoglobin A1C test, it's a blood test that provides your average levels of blood glucose over the past 3 months. Random plasma glucose test, oral glucose tolerance test. The oral glucose tolerance test measures blood glucose after your fast for at least 8 hours. First, a healthcare professional will draw your blood, and then you will drink the liquid containing glucose. What the test numbers tell me if I have diabetes or prediabetes. And I would like to share with you the numbers which you call normal. In a normal level, hemoglobin A1C is supposed to be less than 5.7. If we have this number from 5.7 to 6.4, we call it pre-diabetes, and if it exceeds 6.4, 6.5 and higher, then we call diabetes. Fasting blood glucose is supposed to be 99 or below. If fasting blood glucose is 126 and checked it twice, it's already fit criteria for diabetes. Oral glucose intolerance. The number is 139 or below. The number is higher than that, already meets the criteria for diagnosis of diabetes. And also one of the tests that we call a random plasma glucose test, which also used to support diagnosis of diabetes. The most important question, how to manage your diabetes. We came with these ABCs. A for the hemoglobin A1C test, B for blood pressure, C for cholesterol, S for stop smoking. Follow your diabetes meal plan, which is very important. And I would like to talk a little bit about the details, what you're supposed to eat. The recommendation is choose fruits and vegetables, beans, whole grains, chicken or turkey without skin, fish, lean meats, and non-fat or low-fat milk and cheese. Drink water instead of sugar-sweetened beverages. Choose foods that are lower in calories. The next step with the diet, we have to follow the physical activity program, because make physical activity part of your daily routine. Take your medications for diabetes and any other health problems, even when you feel good or have reached your blood glucose and blood pressure and cholesterol goals. These medicines help you manage your ABCs. Check your blood glucose levels. For many people with diabetes, checking the blood glucose levels each day is an important way to manage their diabetes. What are the recommended targets for the blood glucose levels? Many people with diabetes aim to keep their blood glucose at these normal levels. Before a meal, 80 to 130. About 2 hours after a meal starts, less than 180. What happens if my blood glucose level becomes too low? Sometimes blood glucose levels drop below where they should be, which is called hypoglycemia. For most people with diabetes, the blood glucose is too low when it's below 70. Hypoglycemia can be life-threatening and needs to be treated right away. What happens if my blood glucose becomes too high? Doctors call high blood glucose hyperglycemia. Symptoms that your blood glucose levels may be too high include feeling thirsty, feeling tired or weak, headaches, urinating often, blurred vision. In this case, you have to talk to your healthcare professional, and these symptoms supposed to be addressed accordingly. Thank you very much. I hope this information which I provided to you was helpful. And if you have any further questions about diabetes, please talk to your doctor. Thank you.